Hello everyone. So today we will talk about measles. So measles, as we know, is a acute, highly infectious disease of childhood. Okay, and it is a respiratory infection. Means it spreads through the nasal secretions, nasopharyngeal or oral secretions via the droplet or droplet nuclei. So we'll go into epidemiological determinants. As we know, the causative agent of measles is a RNA paramyxovirus, and in measles there is no carrier stage or no subclinical stage. So, as in the case of tetanus and rabies, this is a disease where no iceberg phenomena is seen, and in this case, cases is the only source of transmission of infection. Now, the period of communicability is from the appearance of rash, it is 4 days before and 4 days after. Okay, so this is a timeline for period of communicability. So, in the case of measles, isolation is effective, and we do isolation for more than 7 days after the onset of rash. So these were the agent factors which we needed to learn about the host factor, that this is the disease which is more common in around age of 6 months to 3 years of age. But in developed countries where immunization of measles so following immunization in developed countries, this disease is now seen in somewhat older age. And one thing we need to know that the more common complications and the severe complication are seen in a age group of less than 5 years and a age group of more than 30 years. Plus, one more important thing we need to remember is that when the child is suffering from malnourishment, the disease severity or the mortality rate increases to about 400 times. In the case of malnutrition suffering children, the disease not only remains for a longer duration, so it affects the child, plus the transmission of disease is going to be for a longer period of time. Okay, so these were the host factor. Talking about the environmental factor, it can occur in any season, but generally in the spring and pre-summer, means at the time of Jan to April, the people tend to uh, remain in their homes, and this is the time of overcrowding. So this is the time when the disease incidence increases. uh, Talking about the mode of transmission, as we discussed, it is a airborne disease spreading through droplet or droplet nuclei. Incubation period is around 10 to 14 days. 10 days when the fever starts, and the 14 days when the rash appears. So we will now move on to the clinical features. Okay, so there is a prodromal stage, when the patient presents with fever, malaise, coryza, sneezing, cough. Okay, plus within 1 to 2 days, the patient will present with the pathognomic sign of measles, that is Koplik spots. Now these Koplik spots are salt like crystals, means crystals of salt that are present uh, in the buccal mucosa, uh, opposite to the lower second and third molar. So these are pathognomic, as you are seeing in this image. Talking about the next stage, that is the eruptive stage. Okay, there in the eruptive stage, it is characterized by appearance of rash, and this happens on the 14th day, and the rash starts by appearing behind the ear, and then this rash spreads to the face and neck within hours, and then to whole of the body within 2 days or 3 days. And now the important thing about this rash and differentiating feature from a rubella rash, which is similar a macule or maculopapillar rash, is that this rash of measles is a confluent rash. As you are seeing in this image, these rashes confluent together, whereas a rash of rubella remains as such and does not confluence with the other rashes. Now, the cause for this rash is that near the small arteries in the skin, the uh, the immune cells attack the virus-laden cells, and this leads to the appearance of rash. Now, in immunodeficient person, this rash will not be seen. Talking about the post-measles stage, the child is really very weak, and he will have diarrhea, and due to this weakness, he will be immunocompromised, and there are more chances of him getting a bacterial infection or a viral infection. Talking about the complication that occurs in measles, so measles lead to diarrhea, otitis media, and pneumonia. Now, pneumonia is the most common cause of death in the case of measles, and otitis media being the most common complication, up to 7 to 9%. And also, we know that post virally measles is associated, or studies are suggesting that it may be a cause for otosclerosis. Now, the complications are more common in children who are less than 5 years of age and who have vitamin A deficiency. Okay. The case fatality rate being 3 to 6% in countries like India, which are developing, and this rate being very low, up to 0.1 in developed countries. Whereas if the patient is immunocompromised like HIV, the case fatality rate goes up to more than 50%. Now, the treatment in the case of measles is mostly supportive, means we have to treat the coryza or the common cold or the rhinorrhea. So we go on treating it, and we give oral rehydration solution so that the child does not go into the stage of malnourishment, because if the child goes into malnourishment, the severity of disease and the mortality incidence will increase 400 times. So we have to consider this we have to consider this situation, that we have to give ORS frequently so that patient do not dehydrate. And vitamin A prophylaxis is given in a patient who is severely ill, okay, or in the areas where the incidence of measles is very high. Now, this measles is a disease which is most commonly associated with disaster. Okay, but remember, the most common disease after disaster is gastroenteritis. These two are different MCQs. Now, talking about the prevention, we'll go with the measles vaccine. Now, this measles vaccine is a live attenuated vaccine, that the strain name is Edmonton Zagreb strain. Now, since this is live attenuated, this will be contraindicated in pregnancy, immunocompromised, and other states which are causing immunocompromised state, like if the patient is on anti-cancer drugs, or a child born with blood dyskaryosis, etc., etc. Now, this live attenuated vaccine, that is Edmonton Zagreb strain, is given in 0.5 ml of dose, which contains more than 1000 infectious virus units, and this injection is given as subcutaneous in the right upper arm. Now, we need to remember that there is a sterile diluent that is mixed in this vaccine, and this sterile diluent is only cooled, means it is not freezed, and thiomersal is not used as the stabilizer, whereas sorbitol is used. So this we need to remember, that thiomersal is not a stabilizer here. Another thing we need to remember is that once this vaccine is reconstituted, means it was freeze dried and stored as such, but once it is reconstituted, it should be used within 4 hours. Another thing is that if it is placed in 37 degrees Celsius after reconstitution, it loses its all potency within an hour. So, the immunity after giving a measles vaccine appears after 10 to 11 days, and it should be given at 9 months. But in the case of epidemic, the time at which the vaccine is given can be reduced to 6 months of age. Whereas in the area where which are developed countries and incidence of measles are low, we have increased the age up to 12th month. Okay. Another case is in case of susceptible contacts, measles vaccine can also be used for prophylaxis of these contacts. And but the thing is that we have to give this vaccine within 3 days of contact of the person, contact or exposure. Now, incubation period with measles vaccine means when following the measles vaccine, the patient develops a mild measles like illness like fever. So this is a reaction that occurs after measles, but we need to remember that this measles like fever appears after 7 days, whereas if the disease was due to measles virus, the symptoms appear after 10 to 14 days. So this is the difference, that there will be a side effect of measles like fever. But another side effect that we are worried about is toxic shock syndrome. Now, this toxic shock syndrome occurs due to contamination, means if the vial is used after 4 hours, means it has lost its potency but still being used. This condition can cause a toxic shock syndrome or due to contamination. Now in this cases of toxic shock syndrome, we will see a cluster of cases because a large number of children will be affected. Another complication is subacute sclerosing panencephalitis. So this is what we needed to know about measles. Thanks for watching.